Knock knees look like this, meaning that the knees are touching and there's a very wide gap between the ankle joints. We also call this genu valgum medically. Hello everyone, my name is Jitin Nasaz, a children's bone doctor. Here on YouTube we talk about children's bone pathology and how to fix it. So let's get into it. So today we'll be talking about a topic that worries very many parents, which is knock knees. In summary, we'll talk about what causes it, what are the symptoms of knock knees, and most importantly, how do we fix it? So what exactly are knock knees? Knock knees is where the knees are bent inward, meaning they're knocking, hence the name. And in that way, the knees are touching and there's a wide space between the ankles. This condition is very common in children. It's most common in children between the ages of 3 to 4 years, even though it could appear a little earlier and stay on a little longer. You're probably wondering what causes knock knees. In very many cases, knock knees are a physiological thing, meaning they are a normal variation of growth. So typically children aged 3 to 4 years have knock knees, and this is often a normal variation. But there are other conditions that can bring about knock knees. This can come about because of nutritional deficiencies. So children who don't get adequate calcium and vitamin D in their diet can end up with knock knees. It can occur because of different metabolic and bone diseases, which can cause the bones to knock out, like to bend out and hence knocking. It can occur because the bone in the child has united badly following a fracture, and therefore it heals with a bend position that we call this malunion. If you're finding this information too overwhelming and would rather just come in to see us, we'll leave the details in the description below so you can set up an appointment with us. So moving on, what are the symptoms of knock knees? So knock knees, as the name says, the knees appear to be knocking. Often it's a painless, benign thing. Children can go on with their lives without any discomfort rather than people noticing that the knees are knocking. In some instances, however, children may complain of pain. They could have some limping and difficulties with walking, especially if the knees are too bent out that they're actually crossing over each other when the child is walking. So I have mentioned that this is normally something very benign and you don't have to worry about it, especially in children between 3 to 4 years. But when should a parent have concern about knock knees? Well, you should have concern if the knock knees are severe or worsening over time. You should have concern if this is associated with delay in the milestones of the child, like the child is growing much slower than you'd expect them to grow, especially in much younger children. Also, there should be concern if the knock knees are associated with symptoms like pain, difficulty in walking. Then it's time to see your doctor. When you go in to see the doctor, they will do a routine clinical evaluation, see how the child is, see if the growth rate is up to par. They'll take some questions about the child's diet and their activity level, and often they might do some blood tests and an X-ray to just assess if the bones are in good shape. Early intervention can make a huge difference in the prognosis of this condition. So that leads us right into the treatment of knock knees. So the treatment is very patient specific, so it's on a case-by-case basis. In most children, especially around 3 to 4 years, after an assessment is done, it will help us know what kind of treatment to institute. In children between 3 to 4 years, very often this is going to correct on its own. We call this physiological genu valgum. And so it's about reassuring the parents and letting them know that we'll keep a close eye on the child, but they shouldn't worry. In other cases, for example, those that have nutritional deficiencies, it's important to provide supplements that can replace those respective nutrients that are absent in the diet to help build the bone and make them strong. And very often we see this correcting out fully. And finally, in the very severe cases or the persistent cases, surgery is the remedy. What kind of surgery can be done for this? I have talked about guided growth surgery before, I'll leave a link in the description below, but you can also check it out here. So guided growth surgery is where we do tethering to help correct the alignment of the bone back to where we want it. So that is guided growth surgery. The second option is osteotomies. Osteotomy means breaking the bone. Osteotomies are an alternative to guided growth surgery, and but they can also be the only option, especially in older children or in very severe cases. So if you want me to create a video on osteotomies, just let me know in the comments below and we'll work on that. So there we have it about knock knees. I hope you found this video very helpful, and if you did, give us a thumbs up and subscribe to the channel as well. And until next time, keep it on Little Growing Bones.